The reason why we always like to reinforce the fact that we align our curriculum with NLN recommendations is because for two reasons. First of all, if you're on the journey to C&E, you don't want to waste time or money looking at resources, using resources that are not going to help you. And then the second reason is because we are accredited as an approved provider with ANCC. Okay. Oh, Marion says one of the classes she's teaching this semester focuses on those competencies. Oh, good. So competency 5 through 8. That's excellent. Well, it's perfect timing because that is what we will be talking about for our entire fall series. And so what I'm going to do is I'm going to go ahead and put in the chat to be compliant with ANCC requirements. Thank you all for your patience while I work through technology. And that's what we do in nursing, right? We pivot. We move on to plan B. We don't sit and get frustrated about how technology is not working in our favor. We just go with it. As long as we have a phone, I say we can make things work when our technology doesn't, right? We can always just flip over to our phone, hopefully when we have it set up properly to be able to engage with our audience, even when our LMS isn't working properly or our software is not working for the in-person class. All right, so Dr. Sellars Educate is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. To receive contact hours, you are required to stay for the entire program or watch the full recording and complete the evaluation. And that evaluation will be available for you all as we get closer to the end of our time together. And for those colleagues that are watching this as a recording, it is already in the portal. Okay, so the title of today's discussion, and you all know how it works. If you're able to turn on your camera, we are going to go into a breakout session. It's always great to see your smiling faces if you're able to turn on your camera. If not, I totally understand, and that's perfectly fine too. But yes, we always like to see your face. Thank you, Miriam, for turning on your camera, and Alicia, and any other colleagues that are able to turn on their camera. All right, so our topic, as we mentioned, we are focusing on our fall series now. It's already here. We are going to focus our time together tonight on leading change without burning out, practical strategies. So, those strategies that are realistic. And of course, you're going to do some self reflection like we always do during our time together. But this is time for you. And I want you all to applaud yourself for taking the time, making the time to invest in yourself. I have to say, this is probably, I would say for sure it is the most enjoyable time for me with Dr. Sellars Educate is just centering ourselves and focusing as a community on what it is that we need to do, what we need to do to invest in ourselves, to take time to pour into our cup, because we know we're constantly giving back to our students. That's where I just ran in from, is from campus, being with my students today is the first session back, and being with the faculty, making sure the leaders feel supported and all the staff. It's just a lot of moving parts, that we all have to make sure in place, making sure technology works. Because, of course, one of the classrooms did not have, for whatever reason, the projector wasn't syncing with the black box that is on the actual desk attached to the monitor. So we have to figure out how we're going to navigate those challenges that pop up during our day that we didn't expect, didn't plan for, to make sure that we're focusing on our curriculum and delivering a quality learning experience for our students. That's what it's all about. So tonight we're focusing on how do we effectively align our decision making process with competency 5, being that change agent and leader, exploring what's practical, what makes sense. And we always want to look at our blueprint. So that's what we're going to pull up next. If you're on a CNE journey, you want to make sure, if you haven't already, that you go to the NLN website. Let's just go ahead and go there together. So we have probably some colleagues in the room, which I'm going to find out from you all. We probably have some colleagues that are on the journey. So if you're on the journey to CNE, CNE clinical, or CNE novice, go ahead and put a 1 in the chat for me. Go ahead and put a 1 in the chat if you're on the journey for CNE, CNE clinical, or CNE novice. Put a 2 in the chat for me if you're already credentialed. So you already have your certification. Okay, CNE, CNE clinical, or CNE novice. So that put a 2 if that's you in the room. And then go ahead and put a 3 if you're not interested in getting your certification. You're just here to get your contact hours, to learn something new, to become a better nurse educator. So if that's you, if you're not on the journey, if you're not already certified, you're just showing up to become a better nurse educator, put a 3 in the chat because we applaud you all for being here as well. Okay, so great. So it looks like the majority are on the journey or already have their certification. If you already have your certification, you already know 75 renewal credits are required for you to renew, and that is every 5 years for CNE and CNE clinical. If you are CNE novice, that is not a renewable certification. So at the end of 3 years, you are expected to sit for your CNE exam. And if you're interested in CNE clinical, if you're CNE novice, reach out to NLN. All right, so the first place you're going to go anytime you are looking at alignment between the content that you are attending, if it's a workshop for nurse educators, any workshop, we always align our content with the blueprint with those 8 competencies for CNE, 6 competencies for CNE clinical. But what you want to make sure you're doing if you're on the journey to CNE is that you're printing out that blueprint and you're doing what we call a self-assessment. Okay, so for those colleagues that are already certified, you've heard us our spiel before. But the first place you want to go to is going to be NLN credentialing. Okay, so you're going to go to nln.org website. Now I want to share this is why it's so important for both sets of colleagues that are here in the room today. If you're on the journey for CNE, then this is your roadmap. This is your free resource that is published by NLN that should guide you in your decision making about your confidence related to these competencies. So when you look at domain 5, it's the same as competency. NLN really hasn't shared why they changed the naming from competency to domains. They just said it's basic nomenclature change, so nothing significant. So don't get distracted by that. But when you're looking at competency 5 that we have aligned our content with for tonight, you're looking at these 8 sub-competency statements. So that's A through I, and you're doing a self-assessment if you're on the journey. So you're trying to determine what is your competence and confidence level. We want you to be at 80%, okay? 80% confidence that when you see a question on the CNE exam related to that concept, you'll be able to choose the correct answer. All right. But we're not leaving our colleagues that are already certified out because you're doing the same thing, except you're thinking about how the content today that we're going to talk about, how it aligns with competency 5 for you. Because when you go to that nln.org website to renew your certification, you are basically engaging in a reflective practice experience. So for competency 5, you would choose that competency and you would talk about the specific learning outcomes that we're going to go over and how those specific outcomes are showing up in the teaching strategies that you are creating for your students. Okay, so again, I want to recap that when you're on this journey towards achieving your CNE, you're looking at this blueprint. This blueprint that we're looking at right now is developed by NLN. It's updated periodically. This is the most current one. That's why we walked to the website with you all today, because we always want you going to nln.org website, printing out their candidate handbook if you're on the journey. If you're renewing, you still want to print out this blueprint because in order to have your renewal accepted when you submit your documentation, you have to align your behaviors with at least 5 of the 8 competencies. Okay. And you have to earn at least 75 renewal credits. And that's why it's so important to choose companies and organizations that are accredited because each of you are eligible for 1 contact hour for our time together tonight. All right, so let's take a look at just a couple. So let's choose E, model principles of diversity, equity, and inclusivity when advocating for change. So who wants to come off mute and share? What do you think that means? How does that behavior, because remember, competencies are about action, right? It's a verb. It's not a noun in the sense that we want to be able to demonstrate these behaviors that we're talking about. So when we say model principles of diversity, equity, and inclusivity when advocating for change, share with us what that means to you, or what would be one example that you would want to share. I'll give you a hint. When we look at our CC&E standards, we know one of them is engaging in curricular changes, right? We should take our end of course survey. We should take the data, both qualitative and quantitative, that we gather from our students to make changes in the future, whether we're doing the strengths and weakness assessment from our students' exam scores, or we're truly taking that qualitative data from our comments for our EOCs. We're consistently looking at what programmatic changes we need to make. So how could that example align with E, including?
I
That's a good one. Yes. Were you going to share something? Somebody on the iPhone. I'm not sure who that is.
oh yeah, I'm so sorry that my name's not popping up on that. Um,
That's okay. Tell me your name. I'll type it in.
this is Dr. Debbie Wallace. I teach at Youngstown State University in
Yes.
Eastern Ohio, but I live in Western PA. So,
Okay.
but I think in not to minimize the situation, but just something as simple as putting our pronouns.
Mm-hmm.
I in again, not meaning to minimalize it by
Yeah.
any means, but I think that's just a really simple way of
Mm-hmm.
including that. So
Mm-hmm.
that's my 2 cents.
Yes, I agree, Debbie. That's a great example. So, encouraging students and colleagues to use pronouns. And when we talk about advocating for change, the last part we would add to that is sharing the why. When we're teaching our pre-licensure and post-licensure students, we want them to have a deep understanding of the why. So yes, the what is important. So adding pronouns, following aseptic technique, making sure that we are knocking on the door and protecting patient privacy. All of those steps are important. And we want to make sure that our students and our colleagues are understanding the why. So when we're making a change, such as asking all students when they join a Teams call or a synchronous call, if we are teaching online, that they are using their pronouns as an example. And we want to talk about why. Why is that important? Well, it shows respect for our students, and we want to role model behaviors that are aligned with equity, diversity, and in developing and creating an inclusive learning experience for our student. So we want to talk about the why, and we also want to role model it. Another good example that I want to bring to your attention related to the one that I mentioned really is making changes in our curriculum. We know that that's a heavy lift. We've talked in our conversations before about transitioning to competency-based education. We had Dr. McMillan Bowler, who was with us during our summer series, and she talks about that quite a bit because of all the amazing work that she does with AACN related to competency-based framework. So we have to think about our why. Why are we making that change? As colleagues that have to deal with a lot of changes in healthcare and in nursing, we know that it's really important for us to have a deep rationale for our why before we make a major curriculum change. Not only is it important when it comes to faculty workload, when we make curriculum changes, if you're a course lead, I'm sure this resonates with you. When you make a change as a course lead, you have to be able to explain it, articulate it, and implement it amongst your faculty that are teaching that class. So it's vital for us to, first of all, make sure that it's a necessary change, right? Just like you can see Competency 5A talks about evaluate organizational effectiveness to determine needed change. So do we even need to make the change? And then second of all, if we decide that we do, going into the research, looking at the evidence to support our why. And then the last part, of course, is making sure that faculty have a voice. So creating that inclusive learning experience, not only for our students, but our faculty is also really important as we're moving changes forward. We don't want to leave our faculty behind. So that means that it can't just be one email. It can't just be one conversation. It has to be ongoing discussion as we move forward with implementing that curricular change. So the three learning outcomes we're focusing on is analyze. So we're going to talk about a case study of organizational change to identify leadership behaviors that promote successful implementation. The second outcome is you're going to be able to create, each one of you, a personal leadership vision statement or philosophy that aligns with competency five. And then our last outcome, you're going to be able to apply a change management model. We're just going to talk about two, Kotter and Lewin, to an academic scenario. And those change theories don't resonate with you, don't stress out about it because we're going to do a brief recap of what each one of these are. All right, so here's our thought-provoking question. We thought we would throw one in for us to kind of talk through tonight. So during an academic program redesign, the dean notices strong resistance from faculty. To support successful implementation, which leadership behavior is most appropriate? We have A, prioritizing individual faculty concerns when considering the shared organizational vision. B, clearly communicating the rationale for change and modeling commitment to the new direction. Or C, allowing the change process to unfold naturally over time without structured guidance supporting shared governance model. So you can put in the chat, which option do you think is the most to support successful implementation? Which is the most appropriate leadership behavior? A, B, or C? And this is what I want you to consider. Just like when you get to the C&E exam, you want to think about, first of all, what is this question really asking me? Sometimes there can be a distractor in the STEM on the C&E exam. Okay, so think about what is this question really asking me? The second thought I want you to have is what is it that I know for sure about content or concepts that are included in this question? When you get to the CNA exam, there are three options, just like this example. There's only one correct answer, okay? And the other two are distractors or incorrect answers. So that's what you want to think about. And hopefully, if you can't get to one answer, you can narrow it down to two, just following those two simple questions as you're thinking about each of the questions on the CNA exam. All right, so it looks like it's unanimous. So my distractors were not very effective because you all are so smart. Clear communication is essential, like we talked about, right? So who wants to come off mute and share? How did you know A was not the correct answer? So how is it that I couldn't trick you into choosing A? What about A told you that was not the best answer? Okay, Marion. Oh, looks like you're on mute, Marion.
We have some naysayers in our faculty who will always argue back, but we have a dean, a leader who she'll listen to concerns, but it isn't a priority. The priority is the why, and we are going to do that major overhaul into competency-based education this week, and we're pretty much, or this year.
Uh-huh.
And so it's pretty much expected that everybody buys in. The people who aren't, she's giving them opportunities to express themselves, but the priority is this is what's going to happen.
Yes. So keeping the faculty focused on the mission is essential. When you're transitioning over into a competency-based framework, it is an incredible heavy lift. And so you have to have a leader with that clear vision and is committed to that new direction because they've already done their homework. They've already looked at the evidence and hopefully they've advocated for additional resources if that's needed to make sure the timeline makes sense and to make sure the faculty moving that change forward is also the proper people, not only the right people on the bus, but making sure they're in the right seat as well. Thank you for sharing that, Marian. All right, so what about C? What led you all to believe that C was not correct, allowing the change process to unfold naturally? That sounds pretty good, right? No? Why not? I'm seeing head saying no. And you all are correct. Why is that? Debbie, you want to share?
Sure. So I'm thinking that that's just kind of, for a lack of better word right now, kind of willy-nilly, like, oh, let's
Mhm.
just see how it all falls into place. I
Right.
kind of think of a laissez-faire
Uh-huh.
leadership that, hey, you know what, let's just see what happens and we'll roll with it then.
That's right.
Uh,
Yep.
that's kind of my take on that.
Yep. That's right, Debbie. Very laissez-faire. And we know the specific question was asking us to support a successful implementation because the decision has already been made. Even though there's resistance, to Marion's point, as deans, as leaders, we can listen to what the feedback is. However, we still have to stay focused, knowing that the change process can be difficult, especially if you have faculty that are strongly aligned with that curriculum and gave birth to it and can't see it any other way. So you want to think about what we're going to talk about are two models of change management. So the first one is Kotter, and yes, I have broke the rule about no more than 4 or 5 bullet points per slide. But stay with me because I didn't want to separate this out into two different slides. So, for colleagues in the room that are note takers, this is definitely one faculty likes to say a writer downer. This is a writer downer. So, Cotter follows an 8 step process to lead complex organizational change. So, his work talks about number one, how urgent is it really? How do we need to take these actions now? And what should that timeline look like? So, communicating why the change is needed now is an important part of the journey. And I'm interested, Mary, maybe when we get through this list, if you can just come off mute and just share how many of these 8 steps, not that your leader necessarily followed Cotter, maybe they followed Lewin, but just curious how many of these 8 steps were followed. Number two, there's power in numbers. And I always say you never want to move change forward alone. You have to have, this model talks about a coalition. I like to say a committee, a group of collaborators that are going to help you move that change forward. And then number three, creating a vision for change. This is important too because it's true that sometimes it can be hard to see the end result, especially a change like competency based because I can remember when we launched competency based, we were the first in the UNC system. And being the first, is an exciting journey and it's also an incredibly challenging journey because there's so many naysayers and there are lots of doubt that can creep up. But you want to communicate that vision as well, because oftentimes vision starts in our heads or in our heart. And so we have to be able to share it consistently. So having those talking points, whatever those 5 talking points are, I'll give you an example. At Dr. Sellars Educate, we say our mission is to support all nurse educators to achieve excellence. For some colleagues, that's C&E. For other colleagues, it's just learning about how to be a better educator and to decrease that cognitive overload that we have to use whenever we're using a new technology or we're using a different framework to talk about a specific concept. We want to remove obstacles. That's number 5. So let's go ahead and put it out there on the table what our naysayers are going to say, like Marion said with her dean, finding out from those colleagues that may struggle for whatever reason, what are some of those obstacles? And then talk about how we can remove them, right? We collectively, because we also want to empower our colleagues about moving that change forward and then being part of the solution instead of being perceived as part of the problem or being a barrier. We want to create those short-term wins. That's really important, demonstrating our progress with quick successes. Now, this is easy to do, I feel like, with students. Sometimes with colleagues, moving change forward is not as easy. But we have to think about, as an example, if we're moving to competency based, maybe we start course by course, which is always a recommendation instead of starting, with 14 courses. That can be overwhelming. So maybe we start with our semester one courses and we celebrate that win, right? We figure out what worked, what didn't work, we tweak it, and then we do a better job for our semester two courses, as an example. But celebrating those wins along the way is a really important part of Cotter's model. And then building on the change, using that momentum to tackle some of those bigger challenges. Now, I will tell you, Developing assessment tools was probably one of the biggest challenges that we had at Winston-Salem State. And so what the team did was they really pulled together subject matter experts that were skilled in developing solid assessment tools. So it has to be colleagues that really love doing that kind of work and figuring out which part of the elephant we wanted to bite and own, I think is another important part of this change transition that happens, such as with competency-based curriculum. And then anchoring the change in the culture. This is so important as we talk about, and as you think about your vision and your philosophy about changes that move forward in your classroom or in your nursing program. How are you rooted in that culture, in that belief, in that philosophy associated with that change that's going to move forward? A good example is competency based, because what we know from the research is that at least some data says even fewer nurses, but at least 50% of our nurses that are practicing right now have experienced some type of adverse event. Either they have committed an error or they know a colleague that has committed an error that has resulted in patient harm. And we know the research says that it's not just enough for students to have that cognitive knowledge. Students have to be able to demonstrate high levels of application and analysis in order to truly engage in those clinical judgment skills that are essential when it comes to the delivery of quality patient care. So being anchored, being rooted in your why and the what associated with that culture shift that is going to happen. And then Lewin is, a little bit more, I like to say, streamlined in the work that he did with his framework. He talked about three phases: unfreeze, so you create motivation, you prepare the organization to say, this is going to change, and then the change happens. So there's a transition that happens. The new procedures, the new policies are put in place, and that the team, the colleagues have to learn and adapt. And then the refreeze, where we're stabilizing. We have hardwired, to use Studer's terminology, we've hardwired this change, and this is what we do. This is our natural progression of how students matriculate through our nursing program by using the competency-based model. Lewin says that it is a simple and intuitive framework. Competency-based is an excellent example because, again, it's intuitive. We know in order to validate competency, we have to observe a behavior that aligns with the evidence, as an example. We want to emphasize readiness for change. And sometimes colleagues are not ready for that change. So how do we get them ready? Well, it goes back to what we talked about with Kotter, and that is being aware of the faculty that may be more resistant to the change, eliminating those barriers, identifying the evidence, identifying your champions that are going to go along with you to be at that table having those difficult conversations, and that Lewin is best suited for smaller scale or clearly defined changes. But Lewin has been used by many colleagues as well. Yeah, culture kills change for sure. Yep. That is a true statement, Debbie. All right, so let's go back. I didn't forget about you, Marion. So share with us, Marion, how many of these steps do you feel like you all experience 1 through 8? Do you feel like you hit them all or half of them?
Well, since we're kind of at the beginning, probably not all of them, but a lot of them. The way this was set up is that our learning center, which is faculty training and so forth, 2 people, and they're doing this all over campus.
Mhm.
But they came and they were part of our first a full faculty meeting this summer. And
Mhm.
pretty much they presented a PowerPoint presentation saying, this is what's going to happen, and then expanded on it. The background is that the leadership had already assigned different people. And as I look closely at the list, they included the early starters in each of the groupings so that we're starting with the AAC and essentials and seeing how it applies to undergraduate, master's as well as doctorate.
Mhm.
So that's kind of where we're at. So the powerful coalition exists, and um, and Ted and Betsy did create a vision for change.
Good.
And I also think that they communicated that very clearly, that this is the direction that we need to go in.
Mhm.
Um, there are still obstacles. So I think that's kind of where we're at. The first short-term win will be this Friday. We're all supposed to have completed an evaluation of just three of the domains
Mm,
as assigned, and then submit that, and they'll look that over and kind of see where people stand on that. So
okay.
that's kind of where we're at. And I think as far as organization goes, they've done a really remarkable job of showing the need. And I think we will build on change, and we will
Mhm,
make this change something very effective that make people look
mhm.
at our program and say, hey, we want more nurses that come out of this program.
Absolutely. Yeah, and thank you for sharing that, Marion, and kind of walking us through and being our organic case study that has just naturally come out in our discussion. And I would encourage you all to do the same. Much of what we do for those that are joining us for the first time every month is really talk about how we can learn from each other. We're getting ready to go to our breakout room where you all can have deeper conversation. And that's what I want you all to think about. This group is a community of support that we know CNE is a huge celebration when you reach that milestone. It's even more exciting, though, to feel like you can actually integrate some of these evidence-based practices into your everyday work. For me, that's the exciting part, that it all makes sense, that it is applicable to the work that you're doing every day, and that you can see how you're bringing life to these concepts that we're talking about. And that's going to help you also on the CNE exam because you're not just studying for an exam, you're really focusing on how you're becoming a better nurse educator, which I think is amazing and promotes resilience. Now, I want to talk about the four steps, which you all have already hit on some of them, to effective change. So, first of all, assessing the need. Do we really need to make this change from an improvement standpoint? Our why. And then the second consideration you want to think about is what are those strategies going to be? How do you identify them? And that is step one, which Marion talked about, is talking to the team, right? As faculty, as leaders, we have to be clear about what our plan is to address whatever that need is, which should be driven, our change should be driven based off of that need. And then implementation of changes of the change. So, how are we going to put strategies in place, in practice to ensure that we are engaging all of our staff members, all of our faculty, because we do need everybody on the team in order to reach that step number 8 that Kotter talks about, that sustainable change. And the step that Lewin talks about too, that third phase where we truly are hardwiring the excellence that we have put into place. And then we want to find out how well it did it work, that change that we implemented. So we want to make sure there's a way to evaluate and assess what the outcomes were, reviewing those results to measure the success. And we still want to make necessary adjustments. When we talk about competency based, it's not just one decision that is made. It's something that evolves over time. So yes, we have specific guidelines that we're putting in place based on the competency-based framework. However, what we know is, especially with our assessment tools, we may decide that, you know what, there's a better way to assess and validate competency than what we thought. So from that perspective, it does evolve over time. So when you think about those two different types, just to recap, of change management models, what's your choice? So you're thinking about Lewin, where it's simple, three phases. It emphasizes preparation and reinforcement, but it's pretty black and white, cut and dry. This is the change. This is how you need to get on board, and this is how it's going to be hardwired. Versus Cotter, it's more expanded. It's 8 steps. It truly is grounded in that leadership philosophy. You could see it come out as we described each of those 8 steps, the urgency of it, and that was step 1, and then the culture. Our ability to truly sustain that change is based on our culture that we're creating within the organization or within ourselves. What type of cultural norms are we bringing into the college that we're joining or the leadership role that we are stepping into? And so, as you all think about and reflect on what your philosophy is, as you're writing that down, whether it's Lewin or Cotter, I'd be interested to know how it influences your response to this question. All right, so this is just a short case study. You all are going to kind of unfold it as you talk in your groups. But this is a statement, and I actually had this discussion with a couple of students this week. This statement is that we should allow students to struggle as this helps them to build higher order thinking and advance their clinical judgment skills. Okay, so you're thinking about, first of all, how do you feel about that statement? Do you agree? Do you disagree? Do you feel like there's pros and cons? There's reasons why and why you would support this statement or reasons why you would not. And then how does it align with your philosophy, your change management philosophy, especially if you don't agree, or even if you do, how would you get your colleagues on board to feel the same way? And I will put a plug in that there is evidence to support that students are having to be challenged in order to truly develop those clinical judgment skills. Oh, and I have a typo. So let me change that. You know, sometimes our um, Canva does not always catch our typos. All right, so that's what you're talking in your small groups about. We're going to engage in think, pair, share, where you all are going to kind of unfold this case study as you think about and reflect on your thoughts, your beliefs, maybe even your experiences related to this question. All right, so we're going to go ahead and break up. We'll do three groups just to keep it small. We're going to take, let's see how much time. Oh, we're doing good on time. So we'll take 5 or 6 minutes or so, and then we'll come back together and kind of debrief. Again, you're thinking about, first and foremost, hopefully you wrote down your philosophy of how you believe change management can best be implemented using either the Lewin framework or the Kotter. And then you're also talking about this statement and whether you agree or disagree, or you can see the pros and cons about allowing students to struggle. All right. Any questions about that? I know me and my students had an interesting discussion. They definitely, I think, triggered me to think a little differently after sharing the literature and the evidence that they found. All right, so we'll come back together in about 5 or 6 minutes. I'll see you soon.
But as far as I'm concerned, with obstetrics, you need to they need to see it delivery, and that could be very frightening. So I'm the type of person that I hold their hand type of thing, and until like mid-semester, and then I let them go a little bit more, you know.
Well, I think that's a good way of starting out because because otherwise you could really scare them. Um, I get these students that I have in their second semester of med surg, and mine's adult gerontology,
Uh-huh.
basically. So it's quite polar opposite of what you're doing.
Yeah, yeah. I mean,
Yeah.
yeah,
I throw them. Unfortunately, I'm in an inner city. I was in an inner city hospital. So I threw them right into the frying pan.
yeah.
They had a little bit of shock, in the whole thing. But they did adapt. I could have told you blindly that I was not surprised of the when I saw who did not turn it in on time
Yeah.
because I know those students and they're kind of like, yeah, whatever. And, I reached out to them, hey, this is not an option. So you still got to turn it in. So,
Yeah. Yeah.
assignments are not an option. So I think I think 4 out of 37 is pretty good, but I still felt like I needed to emphasize that. And I did emphasize it to the entire class. So, um, I don't require them to purchase a book. We do an online platform of engagement.
Yes.
We got our answers, Dr. Seller.
How
It didn't.
similar were your answers? Were they alike or different?
They were alike.
Okay.
I was telling Mary when I first read the statement, I wasn't sure if I agreed with it, but then I reread it. I also wrote it down and I read it again, and I thought, oh, I do agree with this statement.
Mhm.
And I gave her the example of a butterfly working its way out of its cocoon that it needs to
Mhm.
struggle. And I think our students need to struggle in a similar manner.
Mhm.
But then we have to take it case by case because we have those who struggle more and they just need more support.
Exactly. Yeah, I like you, Alicia. When the student and I were discussing it at first, I thought, struggle, like that seems so negative.
Mhm.
But it's because the bias that we have, our personal experiences associated with that struggle. But I love that, Marion. I'm going to have to use that, but I'll quote you, Marion. I love the analogy with the butterfly because that's so true. Look at how beautiful it is after the struggle.
That's right.
And if you support them, if you give them too much, if you spoon feed them too much,
Mhm.
then in the case of the butterfly does not fly.
Right,
The purpose is
right.
to fly.
Yeah, exactly. Yeah, my husband, his saying is that we are raising eagles, not pigeons. That's with my sons, I'm the typical, the son, both of my sons know how to get to my heartstrings. So that's what he used to have to say. They're 19 and 23 and just wonderful young men. But he would constantly have to say that to me. He'd be like, Bridget, we're raising eagles, not pigeons. I would say, okay, you're right.
I really like that.
Yeah.
I may borrow that one.
Yeah.
Yeah.
And it's so true, but very similar to what you're saying about butterflies. They do fly, like you said, if they're nurtured and supported the right way.
Yes.
Yeah.
Yes. All
With
right.
a
Well,
little bit of struggle.
that's right. A little bit of struggle never hurt anybody. Just a little bit, like you said, with the right support.
That's right.
All right. Well, I'll see you all back in the main room in 60 seconds.
Okay.
Okay.
This meeting is being recorded.
Welcome back. So who wants to share? I think that, let's see. Okay, I think we're all back now. So who wants to share? Let's see, from Pat's group. Who wants to share maybe let's go with joint opinions. Let's talk about what you agreed upon within your group. Because we could be here for another hour if we talked about differences. Pat, you want to share anybody from Pat's group? I think it was Pat, Teresa, and Amy. Is that right?
Oh, yeah.
Okay. What did you all agree on? Anything?
Well, I mean, we did agree.
Yeah.
We did agree that, to tell the nursing students to always ask when you don't know something, never assume. And, we both teach in very different scenarios and directions, where I'm adult gerontology mainly, and Pat was obstetrics, which is quite different. And she had the primary people starting out, where I have
Fundamentals.
people that are in their second year. So the expectations are, quite different as to, how much support they need, and I think, was it Amy that was in our group?
Yeah.
She brought out some really important points too, about, having them, think about the situation and
Like
to ask
why?
questions.
It's
Yeah, and
always
ask
why.
why. Yeah.
Yeah. I have a tendency to hold their hand though initially in fundamentals because they're just scared to death. So I do have a tendency. When they're struggling in fundamentals and they're starting to cry, I just and the instructors have said, Pat, you hold their hand, and I do initially, and then I let them go. Like mid semester a little bit, but but I try to model the behavior.
That's good.
I don't have my phone with me. I tell them what you're doing, I'm doing. I'm not there chit-chatting with someone. I'm working with them.
That's
Yeah.
true. Thank you all.
Yeah, and I kind of throw my students like right into the frying pan, unfortunately. And so, for the post-conference, we talk about the positives and the negatives,
Yeah,
their
that's good.
experiences. And, they definitely do a very good job of reflecting in their journals
Yeah.
about their experiences.
Yes, I learned so much reading the journals for
Yes.
sure. Yep.
Yeah.
Good. What about Marion and Alicia? What type of alignment did you all have?
Alicia shared that at first she kind of resisted the idea of offering the support, but the more she read the statement, am I right? The more she read the statement, the more she came in alignment with the idea of providing them some sort of stressor, because it does help you learn. And then I shared with her, is it okay to say it, Dr.?
Yeah.
Okay,
Yeah.
I shared with
Oh,
her the
you're asking
example.
Alicia. I thought you were asking me.
Yeah, the example of a butterfly breaking out of its cocoon, that if somebody helps that butterfly or opens up the cocoon, the butterfly comes out, but its wings are impaired and it can't fly. And that the butterfly has to struggle in order to do what it's meant to do, which is fly. And in a similar way, our students need to struggle to some extent in order to be able to fly, in order to pass NCLEX, in order to take on that new job as an RN. They need to struggle because we can't hand it to them. It's just too easy.
That's so good. I love the butterfly analogy. I told Marion I'm gonna repeat that and quote her, but I love that analogy. All right, what about our last group? Susan, Felita, and Debbie. What alignment did you all have in your group?
I'll go ahead and chime in. So I kind of felt like it was dependent on what level the students were at. I really I didn't articulate it as nicely as the butterfly theory, but they have to struggle a little bit. I think and I didn't say this in our meeting, but I think we're so accessible to students that, they know, oh, they can just email us or, and ask us questions, where instead of kind of investigating, say, hey, did Dr. Debbie, I let my students call me Dr. Debbie, did she put that on Blackboard? Because oftentimes I have. And I just and I have to, put my nice hat on and say, hey, you know what, thank you for reaching out about that. And yes, I answer their question. Just FYI, I did put that on Blackboard. I'm in a tenured position, so then you kind of have to be a little bit nicer. I don't know if that's a very diplomatic way of saying that, because if you're not, then they're going to give you bad evaluations. And so you're kind of between a rock and a hard place there, but yet you want that butterfly to fly. So I think, saying things like, hey, I gave you the answer, I'm going to give you the answer again, but I did put that in Blackboard. So
Yeah.
so
Yeah, I think you're right, Debbie. Figuring out how to say it in a way that does show compassion, yet clarity around expectation is definitely an art and a science to that. And I think that we are role modeling, setting those expectations with our students and following through, developing that collaborative partnership with our students is an early intervention that we should all strive to create that will help us with those difficult conversations when students are not meeting those expectations. So I think you're absolutely right, and I can appreciate what you're saying. And then as we close, so thank you all for engaging in such great conversations. I was able to step into each of your breakout rooms just for a little bit. So as we wrap up and close the loop related to these practical strategies that we've talked about, I want to just put a bow on it. So first of all, when we talk about navigating, I'm preaching to the choir. Some common burnout risk is the heavy workloads, emotional exhaustion, lack of support from our colleagues. When we talk about eating our young from a experienced nurse to new nurse, we know that can also exist in academia. So we have to figure out how can we create more resilience within our nursing department, prioritizing self-care, building a supportive team environment. And that's not, again, going back to we're all leaders, that's not just for the leader with the title. We all have that responsibility, and engaging in professional development activities like what you're in tonight all helps us build resilience to create a better, more supportive learning environment for us all. So, some empowerment statements that I know many of you have already used probably or thinking about. I can make a positive impact on my students and colleagues. My well being matters. I prioritize self care and balance. I am resilient, adapting to challenges while maintaining my passion. Support is available from my peers and administration when needed. So, just thinking about those powerful positive affirmations to build resilience and advocating for yourself. I'll give you a quick example. Me and my deans were talking today, and time off is important, as well as me and the ops coordinator were just talking about this last week. When you are taking time off, I want to support you being off. That means detach from devices. That means handing off any priorities that need to happen in your absence if it can't wait. So, figuring out how we can advocate for ourselves, how we can speak up for ourselves, even if that behavior that's in your work setting isn't aligned with the self care practices that we're talking about. How can you advocate for that? How can you not only advocate for yourself, but you really are advocating for others when we talk about fostering this open communication and collaboration within our workspace? We know teamwork helps promote that as well. So we all are feeling valued. That's human nature, and feeling heard. We heard that come up when Marion was talking about that. Even though the dean was very clear, we're moving forward with competency based, faculty still want to be heard. Students want to be heard as well. And then engaging in continuous learning, knowing that learning is a cyclical process. It's an iterative process, meaning that we are going to grasp some concepts, better than others. And what happens is the more we do it, the more that we're able to gather feedback, either verbal or nonverbal from our students or from our own personal reflection. That's how we get better, being able to embrace this new knowledge and realizing that, you know what, it's not going to be perfect the first time, but it's going to get better every single time. So the inspiration, the success, and support really is the recipe for helping us be more resilient and for feeling like that we are more successful in our roles. Impossible is for the unwilling. I really like that. And then, of course, this image of planting. I know for some colleagues, that's their happy place. That's how they really pause and reflect, is to go out and do planting. So, whatever works for you, we always encourage you all to take just a moment when we close out our time together tonight to reflect. How are you going to act on some of these evidence-based practices that we've talked about? And then the key takeaway, of course, prioritizing self-care, because we can't take care of other people if we don't first take care of ourselves. It is essential for sustaining this passion that we have in education and in promoting our future nurse educators, but also our effectiveness. We can't be the best teacher that we want to be if we're not taking care of ourselves and making sure that we are in the right room. When we choose our space that we're going to grow and build others, we want to think about that. When we're doing our interviews, we know that we're interviewing our future employer just like they're interviewing us. So think about the environment that you want to be in, that you're going to best flourish in so that you can be your best self. That's also going to help you reduce burnout. So, how are you feeling about competency 5? We touched on so many aspects related to the individual responsibility we have for being a change agent and leader, reflecting on your philosophy, as well as how you're going to respond and react in real time to those challenging situations within your nursing program, whether it's curriculum or the student that's struggling, like we talked about. How do we help them through those struggles? What strategies should we use? So, how are you feeling about the content? 1, you feel lost. A lot of it was alphabet soup, or maybe you feel more anxiety related to these concepts. Or 5, you feel ready to teach. Maybe we just validated knowledge that you already have. If you want to just write it down, and you don't have to share, but if you're willing to share, that would be great. Tell me how you're feeling. It would be a 1 if you feel lost, or a 5, you feel really good about the concepts that we talked about. Okay, excellent. I'm seeing fives, five, five. Okay, perfect. And what I will say is when it comes to, and I'll go back to the first slide so you can see. Oh, and let me put that in the actual evaluation tool also. I don't think we had a chance to do that. So I'm going to put in the evaluation tool. So all you'll have to do is click on this actual title, which was around leading change. Any questions as I pull up the actual survey? So you'll be able to click the one for today. Any questions or comments? Any last minute comments you all want to share?
I have an off-topic comment.
Okay, sure.
Question. You talked earlier this year about your 5-minute little blurbs that you do at the beginning of your class time when you do online classes. What platform did you use?
So I've used a couple of different ones. I've used, honestly, just paper and pencil. Like with the in-person students, I use paper and pencil, the 5-minute reflection.
Yeah.
But for my virtual students, I've used a combination. I've used discussion, just a discussion forum. I've used reflection journal. I've used a Loom video where I kind of set the stage. And then I, record a minute or two and then just ask them or make a statement like I did with you all, or I'll just ask them a question. And I'll just tell them to respond to me either in a private discussion, or sometimes I'll have them email me depending on the size of the class.
Mm.
I think you have a lot of different options.
Thank you.
You're welcome. Any other? Hopefully you all can now click on the link and you should see the topic that we talked about today in the evaluation form. It should be a drop down for you now, which was all about leading change without burning out.
Yes.
You should see. Okay, very good. All right, well, I will stop the recording and I'm happy to answer any questions that you all have. If not, we look forward to seeing you